Hello, my name is Dr. MarkAlain Dery, and I'm the co-chair of the ACOI Infectious Diseases Committee. Together, along with the leadership of the ACOI, we want to thank you for all that you're doing as we face this unprecedented time in medicine fighting the COVID-19 virus. Moving forward, in conjunction with the ACOI, we want to share with you some information as it becomes available, as well as some of the bright spots that we are seeing so we can feel a little better about the things that we are seeing and we can feel some hope. So there's three things that we're going to talk about today. A new understanding of the asymptomatic nature of COVID-19. The second thing I'm going to talk about is how this asymptomatic nature of C19 will likely lead to a general recommendation for the general public to wear cloth masks out in public. And lastly, finally, some good news, because it looks like we're seeing evidence that social distancing is working. So let's get started and let's talk about the asymptomatic expression of COVID-19. For us to start doing that, it's important for us to gather information from all over the world so that we can begin to piece together elements of this pandemic. So Iceland just yesterday has tested, or at least reported that they tested 18,000 people for the virus, which is about 5% of their population, and what they found was that 50% of people who tested positive were asymptomatic. The April 1st edition of the MMWR, again, which came out yesterday, identified 7 COVID-19 epidemiologic clusters in which pre-symptomatic transmission likely occurred 1 to 3 days before symptom onset. And of course, when we pair that with the case study that the New England Journal documented with the cluster in Germany, in which we also recognized that there was viral shedding after a patient had gone through their COVID-19 symptoms. And then here in the US, Dr. Redfield, the director of the CDC, is reporting that 25% of COVID-19 patients test positive who are asymptomatic. So asymptomatic transmission certainly poses a public health challenge, and it's leading us to understand that asymptomatic transmission is far more important than I think we all originally thought. So this leads to the next topic, which is very, very fluid, and this is the idea of wearing masks out in public. So as a quick summary, let's quickly review. There's two types of masks, right? There's the types of masks that keep the virus out, right? Those are the N95s. That's what we wear when we're at work. But then there's those that keep the virus in, which initially started as surgical masks, but now we're seeing the CDC recommend, or starting to recommend, that these cloth face coverings as well. And in the past, public health authorities have advised to not wear surgical masks or those cloth masks out in public, as it does not protect the user against the virus. And just to kind of remind you guys, the virus is a 0.1 micron. The size of the virus is 0.1 micron. The size of a human hair, by context, is 75 microns. So when you look at the stitching of the mask relative to the size of the virus, it's like using a chain link fence to hold back flooding waters. It just doesn't make sense. So the purpose of the cloth masks or the face coverings are not to protect the user from getting the virus, it's to protect the public from asymptomatic transmission of the novel coronavirus. And in a sense, this will likely, or at least hopefully, decrease any circulating C19 viral load that's out in the community. So I foresee that probably in the next week or so, the CDC may be making recommendations to the US population for citizens to wear face coverings or masks now that we see the asymptomatic transmission is possible. This mounting evidence that I just shared is likely going to drive that recommendation, although there isn't any scientific evidence that masks are effective in reducing the risk of transmission. And if you see in the references below, I do have a very good article in the scientific evidence and argument against doing this. But the danger in the mask face covering recommendations is that individuals may feel that wearing a mask allows them to not practice social distancing because they have some sense of protection with the mask. And understanding the difference between medical grade surgical masks like the N95 and the scarf and the mask face coverings for non-healthcare workers needs to be clear so that we reserve the N95 mask just for healthcare workers. Again, this is a fluid situation. At the beginning of this week, I would have answered emphatically no to wearing masks out in public. But now, to be honest, I don't know. And to be honest, I'm happy to look into this because this is a non-pharmacological public health intervention, and if it works, that would be great. So lastly, there's some hopeful news here, and that is that social distancing seems to be working, we think. There's some early data in Seattle that shows that preliminary statistical models are providing evidence that containment strategies have lowered the rate of viral transmission, and hospitals so far have not been overwhelmed. Previously, each person with COVID-19 in the Seattle area was likely transmitting the virus to an average of 2.7 other people in March, and that number appears to have dropped, with one projection suggesting that it's now down to 1.4. This is referred to as the R0, the number of people that a person with an infection can transmit a viral disease to. And to give that context, the measles virus has an R0 of 18. So, also, fevers are down in states where the stay-at-home orders have been in place. Internet-connected thermometer manufacturer Kinsa Health is providing that evidence in real time as they track those stats. That evidence helped likely to extend the lockdown being suggested by the White House through the end of April. So please stay on the lookout for more of these regular updates, and to read more from the sources used in this report, you can go to the ACOI.org/COVID-19. That's ACOI.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of this crisis. My email address is madery@mac.com if you have any questions, and I sincerely hope that you and your family are safe. We can do this.